Disclaimer: the content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. And now, ladies and gentlemen, please welcome Ben and Amy to the Heavy Truth Podcast.
For joining us for our debut podcast of The Heavy Truth. My name is Amy Paulus.
I'm Ben Ramirez.
We are both nurse practitioners specializing in obesity management, and we thought it would be interesting and fun for everyone to get to know us a little bit more personally. More importantly, how we met and how we began working together. So, Ben, I will let you start this if you want to go into your journey or if you want to talk about how we met first.
Well, how we met first, I think it's interesting that people want to know that. So Amy and I, like she said, we work in the same field, right, in bariatrics and weight management. We're both nurse practitioners, and I know many of you guys understand Teams, right, when we work from home or work from the office, and Amy and I met on a Teams meeting, not directly talking to each other, but on a home meeting about weight management and things that were going on within the organizations that we worked for. And she saw my picture, I saw hers, and then we both kind of chit-chatted offline, and slowly we became more friends because we realized that we had a lot in common. We were both good-natured, liked to laugh, but we both, I guess, really were just along the weight loss journey that we're currently on, and like we want to have a lot of listeners along with us. Amy, what was your first thoughts on when we were meeting on this Teams meeting?
Well, it's funny because I think I was working for about maybe a couple months before I actually was on any meetings with you, but it was one of my coworkers who brought me aware of you, and which oddly enough, I didn't even know that you existed.
Yep.
And
Well, thanks. That's nice.
yeah, right. And she goes, "You have to meet Ben. There's this nurse practitioner, and he's been on a couple meetings with me, and wow, yeah, he's interesting." And I'm like, "All right, let's bring it on." So, then the next meeting came up, and you were on the meeting, and I'm like, "Yeah, all right, he's here. So let me see what this is all about," right? Well, what's funny with all of that is you and I have very similar personalities as far as we are thinking the exact same thing, and it all depends on whether or not we're going to verbalize it or not. So,
And usually you think it and I say it?
Yes, that's absolutely accurate. Yeah, for sure. Or maybe I'll even message you and say, "Oh, you got to say something," but, and I don't even know what the context was, but I knew, I'm like, "Oh, this may incite some reaction." Well, it did. And then I'm like, I'm in, right? So then, we just kind of started talking, and I knew that we definitely would just kind of jive together,
I think we clicked. Absolutely,
sure.
Absolutely. So tell me, what got you interested in the field of weight management?
Yeah, personal journey, of course, but which I will go into. But I feel as though I always wanted to specialize in something after NP school. So when this opportunity came up, I was so excited that I was, chosen for the position. And I really love helping people help themselves, and I can empathize with them, So, you and I both have had our own issues with, weight and weight challenges, and we've gone through different journeys. But I really felt like I was able to put myself in their shoes, and I thought it would be really helpful for patients to know that I myself have struggled with, obesity myself, and I think my patients relate to us better, right? I mean, now that they know that's the case.
Yeah.
So I really wanted to make a difference. And, our program has grown exponentially, so there's just always somewhere, someone who needs our help.
Right.
And, with 60% of the population either being overweight or obese, it's always there.
Oh, it is always there. You're 100% right. And there's so much out there on all these social media platforms and things that are sometimes just people's opinions, but are, truth-based or word of mouth, or people just get it in their mindset, And like you, I was interested in specializing in something more than the family practice, right, that we had learned in school and became board certified in. And obesity medicine, I felt, was something where I could really help people, because like you, I had struggled with it all of my life. And I tell people I still continue to struggle with it, right? Because even when you get to whatever weight that you feel comfortable at, people say there's still a struggle to stay there, right? And so I think all of the fad diets and everything that's out there, I just wanted people to know that I understood, right? I get it. So like when people come to talk to me, I think they're more apt and more comfortable to talk to someone who understands the shoes that they're in. I always give that analogy, like you don't go to a hairdresser and you walk in and they have really bad hair and you're like, oh, this is who I want to be with. Or you go to a dentist with bad teeth. It's that little thing that people will say, oh, thank you for talking to me. You understand where I'm coming from, right?
Yeah, right.
And I think that's our goal, right? As nurse practitioners, and even doing this podcast, our goal is to, give our opinions and maybe dispel some myths that are out there about obesity or about obesity treatments, but still keep it fun, because yes, it's a serious issue and it's something that affects all of us every day, but you gotta keep that smile, you gotta laugh, you gotta be able to just enjoy who you are. And I hope that that's what we can do, moving forward with our podcast.
Yeah, for sure. And again, I know you're the same way, like with your patients, we joke a lot.
What you see is what you get, I always tell them.
Yeah, right, for sure. And if there's not sass coming along with some of my visits, like my patients are like, are you okay today? You know, because they expect it, and it really helps them feel more comfortable, because it's hard, they're nervous. I mean, I'd say 50 to 60% of patients coming in for the first time are crying. So then we have to quickly turn that and make it a little bit more lighthearted, because I don't want it to be a sad visit.
No.
Like you're here now, this is great. So let's move forward. And, I think that's my motto with my patients. I always try, and I want them to feel comfortable, and I want them to know that you're here. This is the first step, and we're gonna help you. So that's,
I agree.
and like you said, I mean, this podcast it is for non-medical people. I mean, of course, I hope there's medical individuals that listen and have insight and everything. But there's a lot of medical podcasts. And I listen to them, and they're great. I understand them.
Oh, yeah.
But normal, people who don't have any medical background, they don't understand a lot of it.
Yeah.
So I want to make this very easy, simple to understand, so people can really know what we're talking about, and they're not like, wait, what are they saying? Like, I don't understand.
And I want people, I think with this podcast, while like you had just said, there's so much medical advice out there and a lot of medical podcasts, we want people to understand that while we're talking about medical things and we may talk about medications or procedures or diets, by no means are we taking the place of them actually seeing their primary care provider, actually reaching out to their obesity specialist, actually reaching out to their psychologist or anything for medical advice, right? Ours is just our own opinion and what we've seen in our practice and what we see out in social media.
Right.
And what we've done in our own life, that maybe helped us, hindered us, or we just shake our heads and laugh at it. And I think that's our thing is we want people to realize that obesity and being overweight is not shameful, right? We don't need to hide from it.
Right.
And that society already does that to us, and we're not here to do that.
Oh, absolutely.
Right?
Yeah. And, in future episodes, we will talk about really almost everything you just touched on.
Oh, yeah.
All of it. So.
And other tangents, because that's who we are.
Of course. But what about when did you start having issues with your weight and struggling, and where did you become where you are now?
Yeah. So I always tell everyone that I talk to. So when they see pictures of me in the past and when they meet me now, I think they always are surprised where I tell them where I began and where I am now. So I've been overweight all of my life. I was that child who, and many of our listeners will understand, going school shopping and having to go to a store and shop in the Husky section,
The
right?
Husky. At Sears.
It's the Sears,
Yeah.
yes. In the Husky section and or Big and Tall and all of that. And choices were very limiting and still, in a lot of places, still are very limiting, right? And I was that child that would be upset and that would cry. I was always the big kid, right? I was active all through high school and college and to this day. And I joke when I tell my family it was going to be a no-win situation. On one side of my family, I was Hispanic and my dad was a chef, so there's a lot of tortillas and rice and beans. And the other side of my family, I'm German and Polish, so there was a lot of things, strudel and fried foods and all of that. So it was I wasn't going to win, right? But I think over time, then my weight just continued to escalate, and eventually my highest weight was 425 pounds. And I had high blood pressure and I had sleep apnea and I had diabetes in my family. And that's when I knew I need to make a change. And I had gone through all those fad diets, right? The deal a meal with Richard Simmons, sweating to the oldies back in the day. Because let me tell you, I would put on my shorts and I would be sweating with Richard Simmons in the basement and then go upstairs and eat a Big Mac and some fries.
With your fro?
With my fro, yes.
Yeah. Uh-huh.
Absolutely. And so I had tried all those fad diets and there was always down a bit, up and down, up and down. And then finally I knew I had to make a change. So I did the changes that I know we'll talk about in future episodes in my own life to get where I am today, which I'm happy to say my goal weight was 220. Now, my BMI still shows me as overweight, right, for my height, but going from 425 to 220, going from a 5 to 6X in a shirt to a large to an extra large, 58 size pants to a 34, 36. I think it's a big change. And now I feel healthy and I'm active. And I was always active, but now the knees don't hurt and all these things. And I'm 52, and people are always shocked when they see that I did this later in life, right? Mm-hmm. And that was my journey. I needed to make it. And I, like you and I have always discussed, right? Everybody can say, lose weight, lose weight, lose weight. Oh, you're so pretty oh, you're so handsome, but, and until we decide to make that leap of faith and that jump, that's when that happens. And that was a turning point for me. I mean, I saw things in my own family that needed to change.
So genetically, did any of your family did they struggle with their weight?
Yeah, I mean, many of my family members did and do struggle with their weight, So there probably is a genetic component in my family that struggles with weight, definitely.
What about any like traumas? Because that goes along with it too. Like, you say, was there a past trauma in your life maybe that has caused weight gain?
Not that I can reflect on,
Yeah.
right? Looking back on it, no. I can't say that I can pinpoint anything that was traumatic in my life that caused me to start to do the weight gain. I think it was just I was one of those people that was excess calories, and genetics behind it. I played a role.
Yeah, and very similar for me too. I feel I was always heavier. Like I was a chubby girl. I was always the girl who was the heavier one in my group. But looking back, like I really wasn't,
right?
But compared to them, I was, So I always had that, and then I had a sister who was always a lot smaller than me. Like she was just very petite. She was shorter, and I always was compared to her by family, by friends, and I compared myself to her, right? So that was hard for me as well, and I, if I could say if there was a trauma. Maybe. I mean, I was very sick as a child, and I was in the hospital a lot, and I always say that I was abandoned, and if my family is listening to this, they'll probably laugh and roll their eyes, but, I was...
If my family's listening to this, I blame you with all that food. No, I'm kidding.
Yeah, right. But, you move on, but my family genetics is also, they're heavy, so I struggled with weight my entire life, and... we talk about how heavy you were, and I used to be embarrassed to say it, but now I'm not. I mean, at my highest, I was 260 pounds, and I'm 140 now. So I am at my goal weight. Definitely, I have to work at it. I have to make mindful choices. I get noticed more. People talk to me more. Which is sad.
Can I ask you a question? When you say goal weight, I know I said it as well. Now, I want to clarify, at least for myself, when I say goal weight, it was my own goal weight. It wasn't something that my primary care provider said, this is your goal weight, or anybody said, or the BMI chart said. It was my own decision of what I thought a goal should be.
I agree. I'm the same way.
Okay.
Like you always have kind of, most people, they have a number in their head. I just wanted to be healthier, and I am lower than what I originally had set as a goal weight, but I am very happy with where I'm at, and I definitely work at it. Could I be better on exercise, as you tell me? Yes, I definitely could. And that's coming. But again, it's a work in progress.
Yeah.
So
It's what do you and I always say? It's always progress. It's never perfection.
yeah. And that's what we want. That's what we want, people to show that they're making an effort, and that's all if I could stress that at all, you're making an effort. You're here. If they come see me, you are here in my office, you are making an effort.
Yep.
So proud of you. Kudos.
Yeah, exactly. Looking back then, what made you go into the field of medicine? What made you go into nursing and then?
That definitely came from me being in the hospital all the time. So
Yeah.
I had all these nurses taking care of me. My parents worked full time. They had their own business. So the nurses were my caretakers, and I really, I glommed onto them, and I just knew, I think I was 8. I was 8, and I said, I know I want to be a nurse. I'm going to be a nurse. Not many people know as a child what they want to do as a career. I knew from the time that I was 8 years old that I wanted to be a nurse, and then, eventually a nurse practitioner. And then when I was in NP school, I said, I want weight management, obesity, wellness, something like that. So I knew that was my end goal, and fortunately, I'm there.
Good.
So it's good. Yeah.
Awesome.
Yeah, so
Why'd you guys decide to call it the Heavy Truth? You guys want to go into that?
well, it is kind of funny.
And now let me preface that Amy and I probably use some jargon that people will be upset about. We say heavy, we say chubby, we say fat, things like that, but we don't mean it in any derogatory way, shape, or form, right?
No, and we say it because we feel as though we were
We
there.
own it.
Yeah, we own it.
we
We
own
were
it.
there,
Right.
so we can, kind of pick fun of maybe where we're at,
Yeah.
or where we were.
Where we were.
Yeah. So I'm going to take credit for the Heavy Truth.
You
that was,
should take
that was
credit
me.
for the heavy truth. That was you, yes.
Yes, and that came about from a presentation that we gave.
That I sprung on you?
Yes, that was quite funny. Yeah, that was something. Wow. I mean, I remember the call. You're like, so, yeah. Well, I did a thing, and I'm like, oh, all right. Well, what? Well, you're part of it, and I'm like, what are you talking about?
Yep, I did a thing for us.
Yeah, and lo and behold, a presentation at a conference, bunch of nurse practitioners, which was great.
Which was
great
great. It was
exposure.
amazing.
We did it was everyone loved
Yes,
our talk.
Someone had reached out to me, and they knew that I worked in the field of bariatrics and weight management, and had asked me if I would be interested in talking at a statewide conference for that subject. And I said, "Oh yes, my colleague Amy and I would love to do that." And I signed you up for it, and let them know that we would definitely take that slot at Friday at this time, and we would be there. And then I let you know I did a thing for us.
Yeah, and then not only that,
But
then
can you
I
help
get,
me put this together now?
right. Then I was assigned the task of actually doing the presentation.
Yes, we did it together. But you mean doing the PowerPoint?
Doing the PowerPoint
Yes.
with all the, the guts, right? You can talk about anything.
Was it the final or the final?
It's probably the final. Shh, enough. But I think it's the name of the Heavy Truth came from, well, we always talk about all the fats.
And that's what we call ourselves. So when we talk about our past self, we'll say, "Oh, when I was all the fat," or all the fats. And so we thought that would be a fun topic or a fun title, right? You thought that'd be a fun title, all the fats,
All the fats.
because then we could talk about a variety of different things.
Yeah, right. But then soon we found out that there was another podcast out there that was similar to that name, and then
Had nothing to do with weight management.
no, it was about food.
Food, yeah.
Right. So we wanted to make sure that we didn't get too close to that.
Yep.
And then we didn't want to offend anyone, which
Yep.
is never our intent.
Never our intent.
So then, for this presentation that we gave, this was the title of the slideshow, and it
Stuck. Yeah, right.
It stuck.
Yeah, because
Yeah.
that's exactly what it is, right? We talk about our truths or the truths that we find out about a lot of these different topics in obesity, in the world of obesity medicine and
Right.
diets and weight management. So that's how that stuck. And it was a very successful presentation.
It was.
Oh, and we've been asked back for next year, by the way. So there
Oh,
we are for
wow.
us.
Okay, sounds great. Yep. and now it's put on me once again. But at least I got more time.
Now,
this
yes, you
time.
got more time. So tick tock, tick tock. Yeah, exactly.
What do you guys got coming up on the next couple episodes? You guys got?
Yes.
You guys tell everybody what you're going to be talking about.
All right. Let me get my notes out. I need my glasses for this
Oh.
because, I am
Old.
older.
Yeah.
Not as old as you, but
I
You
don't
know.
need those glasses.
that's because you had your eyes worked on.
Or the fact that your text on your phone is larger as well. But
Yeah, that's true.
did that happen because of when you lost weight, your eyesight went too? No.
Do you want
No.
someone to be at this conference with you? Episode 2, really just getting into the details of chronic obesity and how it is a chronic disease. Then we're going to give some tools of success. That would be episode 3. And then we're going to talk about getting moving, so it's moving and grooving, making sure that exercise is part of your, not necessarily daily activity, but it should be, 3-4 days a week at a minimum. You gotta move,
Yeah.
and it's important.
Yeah, I agree. And then I think we looked at a lot of different topics that'll be coming up, right? We are going to talk about some of those fad diets that we talked about. We talked about we're going to talk about medications. We're going to talk about things like
Lack of sleep.
how important vitamin D is, water intake, just what we see also out in the population, and we'll take questions from you guys too when you write us in if you want to talk about any topics. If you come across us on Facebook, TikTok, Instagram, any topics that are important to you guys, and there is our website for the Heavy Truth.
Heavy Truth, theheavytruth.net. But yes, so we are so excited to be here. Thank you for listening. And
Yes.
please, we love feedback. And like Ben said, any topics that anyone has a, interest in,
Yeah.
we are willing to.
Or just want to know more about.
Right.
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 Yeah.
Yeah, very
absolutely.
true.
We are willing to dive in it head first
Yeah.
and look at it.
Yeah, there's
and-
nothing off the table.
No, nothing up. Absolutely nothing off the table.
No.
Because let me tell you, we talk about it all the time,
That's
and now we
right.
decided, you know what? We're going to talk about it with you,
Yeah,
not just between her and I.
that's right. That's right.
Right. Well, thank you for listening to our first podcast.
Yes, and I do want to give a kudos to Mike, our producer. We couldn't have done, we cannot do this without him.
We
So,
cannot. That's the mystery voice you hear off camera.
yes, that's right. So, thank you, Mike, for
Thanks,
everything.
Mike.
And, oh, right. He's giving himself a kudos,
Yeah, kudos to that, Mike. Yeah, big props.
All right. Thank you. We'll
Thank
see you
you.
soon.